If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. No, be what I wanna be. If I work hard, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be.
We're just going to give it 4 more minutes. So we start at 12:10, if that's okay. Daniel, so when it's 12:10 or 12:10, so in 3 minutes, I'll pause the music and you can take it away, please. Thank you.
Okay. All right, thanks, Ada.
Be what I wanna be. If I work hard, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. No, be what I wanna be. If I work hard at it, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. No, be what I wanna be. If I work hard at it, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. Be what I wanna be. If I work hard at it, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. No, be what I wanna be. If I work hard at it, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be. No, be what I wanna be. If I work hard at it, I'll be where I wanna be. I know I can. I know I can be what I wanna be. Be what I wanna be. If I work hard at it, if I work hard at it, I'll be where I wanna be. I'll be where I wanna be.
All right, hi everyone. Good afternoon. Good morning from Nigeria if you're here with me. Also good afternoon from everyone joining from anywhere else, as well as those who will join us subsequently. It's nice to have you here. Thank you for taking time out of your busy schedules to be here today. So we'll just cut right to it, and we expect to have more people join us as we journey along. So today is July 19th, 2024. And we're having a keynote speaker. Our topic for today is my journey into internal medicine. And we're having with us Dr. Sorry, I have a bit of a cold. We're having with us Dr. Songo Jane Lolomari. She is a UK trained medical doctor and a member of the Royal College of Physicians in the United Kingdom. Okay. Sorry about that. My video is off. I didn't know. So she's currently finishing the first stage of internal medicine of her postgraduate medical education. I'll just take that again. So today we'll be talking about Dr. Songo Jane Lolomari's journey into internal medicine.
Sorry, someone joined without muting. I've muted them. So
Okay, thanks, Ada. So Dr. Songo Jane Lolomari, she's a UK trained medical doctor and member of the Royal College of Physicians in the United Kingdom. She's currently finishing the first stage of internal medicine training of her postgraduate medical education. Now she's our keynote speaker for today. It's an absolute privilege to have her in our midst. But before we bring her up to the podium, we'll just go through the opening remarks and a number of other housekeeping details. So I'll just run through the agenda. So currently we're on agenda item number 1, that's the bringing of guests and participants. We'll also be proceeding from this to recognition of students and schools present. Hi, Adam. Can I confirm if you have any schools present here? From
I think the NGO in Enugu is here. That's Ifunanya Udenta. Because I think the other time her camera was on, I saw some students sat. So yeah, we have students from Center for Memories in Enugu today.
Yes, that is confirmed.
Thank you.
All right, thanks, Ifunanya. Thank you so much. Thanks, Adam, as well. So it seems I have jumped the gun a bit because I've already done the introduction of the keynote speaker. But that's right. We will definitely cut to that again before we go to the actual business of the day. So we'll have a Q&A session after Dr. Songo is done. So let's go to announcement and closing remarks. So I'm pretty sure pretty much everyone here has had an interaction or two with a child, and I'm sure most of us are already partly or fully educated. So the just largely exist to provide answers to questions that has to do with children, because as we all know, knowledge is power. And we try to have our kids be as powerful as possible because children are the future. It sounds cliche, but it's the actual truth because our future actually lies in the hands, not just of us, but of those who we, not just in our hands rather, but the hands of those who come after us. And that's why we are pretty much here to answer one very important question, which is, what do you want to be when you grow up? At some point, I had to answer this question, and I had a number of answers, but a number of very interesting answers. At some point, I wanted to be a pilot. I wanted to be a lawyer. I also wanted to be a magician at some point. That was a stranger for because of all the answers I had. But today I'm a lawyer, and it's really good being a lawyer. It's great stuff most of the time anyway. So we'll be helping kids take a step towards having a very specific answer to this question. What do you want to be when you grow up? Not just having an answer, but having a why behind that answer. Like, why do you want to be a lawyer? Why do you want to be a doctor? Why do you want to be a content creator? Why do you want to be a production manager? Why do you want to be an internal medical practitioner? So a bunch of these questions is actually why we have JuCE, because JuCE helps kids pick the right boxes for their career, because a career is not a one-stop destiny. It's not a one-stop decision. It's a decision that has like a long-term ripple effect on your career, on your family, on people who may not know you today, but they'll definitely have to interact with you in the future. That's why we have JuCE. JuCE exists to help children give the right answers to this question and then to be as prepared as possible for all the steps they need to take once they are grown. So I've already spoken a bit about JuCE. So JuCE largely exists to actually prevent a career exposure deficit, because we have noticed over time that a number of children, they are short-handed or they are handicapped when it comes to their long-term careers. Yes, they want to be doctors, they want to be lawyers, they want to be a bunch of other things, but they don't know how to make that jump from point A to point B. And so we have a number of JuCE solutions that tailor to help children, or rather halving this deficit. So we have the JuCE Career Spotlight, like we're having today, where we have Dr. Songo speaking to us on the topic of internal medicine. We have presentation of fireside chats, also looking to do JuCE internships. Okay, I'll put in presentation mode now. Okay, can everyone still see my screen?
Yes, thank you.
All right, perfect. We also have the JuCE Career Fest. We have a number of things we are actually tailoring to actually solve this career exposure deficit. Beyond this, we also know that it's like a career mentorship deficit, because children don't always have the best role model to look up to. They want to be doctors, they want to be lawyers, they want to be a number. Sorry, I'm mentioning formal profession, because even informal profession are also part of the conversation we have about JuCE. So there's always that gap between where they want to be and see role models who have gone ahead of them to actually fit into those boxes. So we're also looking to help kids have one-on-one between mentors and mentees so that they can interact with those who have gone ahead of them and be better prepared. And then finally, we also have the lack of, this is actually a problem, it's a lack of knowledge and university preparation programs. Now, I went to a school, I was thinking a few days ago, I went to a school that was named University Preparatory Secondary School, and it's like the Captain Obvious of it, because all secondary schools pretty much exist to prepare kids for university. Now, at JuCE, we actually identified the fact that we don't have enough programs preparing kids for university, because once you're leaving secondary school, 9 out of 10 kids are probably going on to university, but they are not ready, don't know what be required of them at the university stage, and they will definitely be left handicapped. A few weeks ago, when I was in Dr. Songo's shoes today, I had mentioned how, for me, secondary school moved to the university has gone from being a big fish in a small pond to being a small fish in a very big pond. So it can be a very shocking experience when you move from secondary school to university, because a number of things you need to be aware of. The curriculum changes drastically, then the environment changes drastically. You're no longer with your parents. You have to be very prepared to live on your own. You now have to juggle the personal life and your school life, and then going on to have a career. So JuCE also has a plan in store for making kids to be as ready as possible for making that transition onto university. So our vision, I'll just read this out so everyone is on the same page. So our vision at JuCE is to see a Nigeria where our children's career paths are intentionally thought through, developed, and chosen. This will expose young children to as many career paths as possible, both traditional and career paths of the future. We hope that by doing this, children and young people are equipped with insight, tools, academic and non-academic, which are needed to arrive at their desired careers. Now, our mission at JuCE rather is building the future with clarity and intentionality. This is very important to us. So we're not just looking at this because you said there's a deficit. I need to be as intentional as possible with the children because they are our future. And the more intentional you are, the more defined and well structured your future will be. So how do you come in? Everyone is needed around the table. It's like an all hands on deck situation because we have a career deficit, we have a mentorship deficit, we have a lack of programs in place. And so how do you come in? Every week, every 2 weeks, you have events, and it will be very lovely to have everyone in the room and even much more people attend these events so that we can make our collective contributions towards the future of our children and nation as well. You can become a member of JuCE, you can become a mentor, you can become a sponsor, you can become a career partner. So there are different boxes into which everyone can fit in. There is no shortage or scarcity of roles. You can be a mentor, you can be a sponsor, you can be a career partner, you can talk to other people about JuCE, you can even connect with teenagers with JuCE today. You can also, everyone has social media on their phones. There's WhatsApp, there's Instagram, there's Twitter, there's Facebook, there are a bunch of socials that you can actually share our content. And the good thing about content is you never really know how far it will go. That's true, never really know how far it goes. So if you share our content, people can see that they can help a kid's future out there. And we look forward to having everyone coming to these roles in one way or the other. So we are now moving on to the business of the day. I think I've given a bit of a keynote speech already. I don't hold much more Dr. Songo's time. So once again, our keynote speaker for today, for those who joined in a bit behind schedule, we have Dr. Songo Jane Lolomari. Dr. Songo is a UK trained medical practitioner and a member of the Royal College of Physicians in the United Kingdom. She's currently taking on the first stage of her postgraduate education in internal medicine, and it's an absolute privilege to have her today. We will not take this for granted. And at this point, I'll give up the floor to Dr. Songo to take it away. Thank you very much, everyone.
Thank you so much, Daniel, and thank you for inviting me. It's such an honor, honestly. So today I'm going to be talking about my journey into internal medicine. First of all, I'll talk about my journey into medicine because it's been a long road, and I think hopefully people benefit from hearing about my journey. Next slide, please. So a bit of my background. So I grew up in a family of five, with two younger brothers. My dad was a civil servant. Now he's retired. His last job was in a government insurance company. My mom is actually a medical doctor, still working. Growing up, hospital is like a mini hospital slash clinic was near my primary school. So a lot of times after we finished primary school, we used to go there to wait for her before we all go home together. And strangely enough, I really enjoyed that hospital environment. Like the team was very nice. I noticed mom was well liked by patients, by her colleagues. She was making a difference in the lives of people. So I decided at that point that I wanted to be a doctor. I also noticed just by observation that it was quite respected being a doctor. So then those were my reasons. for wanting to become a doctor. But bear in mind, this was when I was a really small kid, but like I'm talking about 5, 6 years old. So next slide, please. However, I changed my career aspirations. This was because when I was about like 6, 7, I went to visit a neighbor and he was a baby, was getting circumcised. It was just too much. I was like, this is too bloody. I don't want to do this. So I made a lot of changes. I visited an auntie in a bank, saw her counting money. Then I was like, oh, these bankers must be rich. Probably want to be a banker. You know, as a kid, your priorities are a bit different. Then along the line, I changed so many times, wanted to be an actress, singer. This was all in childhood. At some point, I thought about chemical engineer. And finally, just one, just two, I noticed I had a real aptitude for like science, integrated science. I loved studying like biology, chemistry. So then naturally they're like, oh, if you don't want to do, if you like science, it's either medicine or engineering. I was like, I really like biology, so probably medicine. And I liked how my mom used to work. So yeah, medicine. This was just one, just two. Next slide, please. So I just thought I'll give you a snapshot of my education slash career so far before I go into detail. So 2003 to 2009, I was in secondary school in Nigeria, actually, Queen's College. 2009 to 2010, so I went straight into um medicine at Unilag. I highlighted it because I've actually gotten into medical school twice, so I'll explain the reason why later. Then I did 1 year because I moved to the UK after just 1 year of medicine. Then I had to do a foundation course because I didn't have A levels or anything. So I did that for 1 year at Newcastle. Then I went on to do a degree, a bachelor's in biochemistry at Newcastle Uni before going back into medical school for 5 years, finishing in 2019. Then the rest of it is just working as a foundation doctor. Then the next stage, 2021 to 2024, which I'm wrapping up now, is the first stage of internal medicine. And from 2024 onwards, I'll be doing later in the year the second stage and combining it as a dual specialty with endocrinology. Next slide, please. Sorry. Yeah, so I thought I'll just talk a bit about getting into medical school in Nigeria and deciding to move abroad. So my WAEC subjects then were like biology, chemistry, physics, English, agricultural science, geography, economics, and Igbo. So um those 9 ones. Then I had to do JAMB, which you have to do to go into a medical going to university in Nigeria. So my subjects were English, biology, physics, chemistry. Then I did the post UME as well. So I was I got into Unilag. I was there for 1 year. It was going well, but along the line, I got a scholarship from my state government, which is the River State government, after doing an exam and an interview. And so the plan was the scholarship was actually to study medicine abroad. But as you know, the Nigerian system is not very organized. So they didn't really find out the requirements are to study medicine. You either have to have A levels or be a graduate in a medical in a biomedical or science related field as one of the entry requirements, which I didn't have. So the other option was first of all doing a foundation course to prove that I had the academic proficiency to get into a UK university as well as the English proficiency. So that I did for just under 1 year. But the foundation course is not enough to get you into medicine. So I had to do a different degree, which was biochemistry. Because again, I love biology and chemistry. So I did that for 3 years before deciding to go back into medical school. So the next slide, please. So again, I had to ask myself, why do I want to study medicine? Because it was a different ball game from going into Unilag straight from secondary school. This I already had a degree. I already had a job offer like from a lab, and my project supervisor had already discussed that if I want a PhD place based on um my final year project from biochemistry, that she can work things out. So I had to really think of it because this was going to be another 5 years of my life, 5 years of not earning properly. Like, do I really want to do it? It's a lot of time commitment, financial commitment. So I had to really think about it. So some of the reasons that encouraged me to go for it again, is a fulfilling career. You're literally saving lives. You're earning a living by helping people. I'd done some workplace like shadowing and stuff. So I knew I enjoyed interacting with patients. I didn't want a lab-based role because a lot of the biochemistry like job opportunities involve like research to go into academia and all that. But I knew that the lab environment wasn't for me long term. I quite like interacting with people. Again, I like science. I enjoyed like studying biology, human anatomy, physiology. So medicine was a good choice for me. Thinking about the future as well, like good job prospects. There's always job opportunities in wherever you go, really. The pay as well. I know we don't like to mention money because it's not really a polite thing to talk about in society, but it's important to think about it long term as well. Although it's not like a high paying job, it's not like investment banking or something. It's okay, you're going to live a comfortable life as a doctor. Then again, I like the fact that it wasn't going to be boring in the long term. Like it's challenging, you're always learning, always studying. The patient, there's a lot of reasoning involved in your day-to-day work as well. The patients don't always present the way that they're described in textbooks. So there's a lot of analysis you have to do. So the next slide, please. So on balance, because I like to tell people the other side as well of medicine, just so people can make an informed choice. Obviously, it's a long career, like I said, a lot of time commitment, and for a lot of people, a lot of financial commitment, especially going to medical school. There's loads of exams, even at a postgraduate level. Like you to climb up the ladder, you have to do a lot of exams. Lifelong learning. If you're not someone that likes learning, like studying a lot, you may struggle. Again, it can be stressful sometimes. Um, Loads of complex patients to manage, long working hours. There's the shift pattern. This week I just came off 9 shifts, so I'm trying to reset my body clock. And there's the emotional toil of it sometimes where although a lot of patients do well, sadly there'll be some that even if you do your best, they won't just respond to the treatment. So keeping that in mind is important as well. Next slide, please. So I talked about getting into medical school in Nigeria. This is now getting into medical school in the UK after studying biochemistry. To be honest, is a lot more complicated. I would advise anyone, if you want to go through this route, to start planning at least 2 years ahead of your proposed entry, because and keep yourself updated with the requirements because they are always changing as well. So things you need, first of all, like any system, you need to meet the academic requirements. So the standard for like UK people is they have GCSEs, you have to have certain grades like A's or A stars and A levels. But there's also the other route, which is what I did because I had a degree in biochemistry. So some universities accept graduates with either a first class or 2-1 in their degree. So I had a first class, so that was my how I met the academic requirement for that. Then the second part is where it gets really complicated because you have to write a personal statement. Now, for Nigerian university, once you can meet the academic requirements, pass your WAEC, your JAMB, your post-JAMB, you get in. But with the UK, they want to prove that you have the interpersonal skills, you really know why you want to come into medicine. So there's a lot of things you have to do. They want to make sure you're doing it for the right reason, not just maybe your parents forced you to go into medical school. They don't want that. They want to ensure that apart from the academic requirements, you have the right personality and skills. So the personal statement is like a letter you're writing to the medical schools why they should take you. So, sorry. So in that letter, write why you want to study medicine. So, um, and they want to show that you're really altruistic, you're out doing it to help people, not just for your personal gain, and to prove that you should have had some volunteering experience. So I volunteered for a while in a hospital in the UK. Like, you have to have some clinical placement experience. Um, so work experience. So you have to shadow a doctor to show that you really know what the career is all about, because they're going to ask you about that in the interview as well. Then they'll ask you about your hobbies. They like people that have a quote unquote balanced life. So they'll ask you, what do you do outside medicine? And to be honest, preferences are given to people that are into like sports, or like people that are into skills like music, because even the universities that want to take you, they want people that can like represent them in competitions and stuff. So those people are given a lot of preference. The third thing is a clinical aptitude test. So at the moment, there's two, the UK clinical aptitude test, and there's the graduate, I've forgotten the full meaning of the abbreviation, but it's the GAMSAT, is like the graduate entry one. So different universities require different tests. The ones I applied to, I did the UK CAT, is basically a reasoning test. They do quantitative reasoning, verbal reasoning, abstract reasoning, situational judgment tests to see how you handle yourself in a clinical situation. It's another way they just used to filter out people. I don't think it really corresponds to how good you're going to be as a doctor, but that's my personal opinion. Then, if you've gone through all these and you've scored really high, you'll be invited to an interview in the medical school, where again you're going to prove, they'll give you different scenarios, and they want to see how you're going to be able to conduct yourself as a medical student and a doctor, and prove that the things you wrote in your personal statement are really correct. Um, so I attended the University of Leicester for medical school, graduated in 2019. So next slide, please. Okay, so before I talk on internal medicine, just wanted to give a brief overview of the UK postgraduate medical training. So after you finish medical school, you do a foundation year 1 and 2. That's just to get basic skills as a doctor. You rotate between medicine, surgery, psychiatry, GP, just to acquire skills. This is just for the UK, because the US system is different. US, you finish, you go straight into your residency. They don't want you in doing different things at a time. But the UK wants to expose you to different areas before you make a choice. So you do foundation for 2 years before choosing going through a dedicated training pathway. So internal medicine training is the path you go through when you're not doing, for instance, acute common course them. Acute common course them is for people that want to work in A&E, people that want to work in anesthetics, which anesthetics is like people that put people to sleep before surgery. Um, then there's run through training, people that want to work as eye surgeons, like ophthalmologists do it, obstetrics do it. Obstetrics is doctors that take care of like pregnant women. So that's run through training. General practitioner, they do just everything. Kids, adults, women, you name it. But they work in a clinic setting, and their job is they assess you like in community. If you're is needed, they send you to the relevant specialty in hospital or like psychiatry. So it depends. Then if you want to be a surgeon, you go through core surgical training. psychiatrists, which is mental health, the people that deal with severe depression, schizophrenia, they do psychiatry training. So everything else, the medical specialties, I'll talk about them later. You must do the internal medicine training stage one at least before you branch into your specialty training. You can do the internal medicine training stage two as well, but not everyone does it. But you have to have the stage one if you want to go through a medical specialty, which is not the rest of these other things I've mentioned. So next slide, please. So what is internal medicine? First of all, it's an area of adult medicine focused on prevention, diagnosis, treatment of illnesses affecting the internal organs of the body. So the heart, the lungs, the kidneys, the gastrointestinal tract, which is your alimentary canal, your brain, muscles, joints. So internal medicine physicians manage illnesses across multiple organs rather than just specializing in, let's say, the heart, like cardiologists, or let's say the lungs, like a respiratory physician. So they do the initial assessment, initial management. If it gets too complex, then they can get a specialist input. Let's say they have a heart problem that the internal medicine physician has managed, but is still not responding to treatment. Then they can get in a cardiologist, which is a heart doctor. So in the UK, you can do just internal medicine, or like I said earlier, you can do the first stage, then the second stage, you combine it with another specialty. Let's say you want to be a heart doctor, you do the internal medicine stage one, then for the stage two, you combine it with your relevant specialty, cardiology. Um, so because there's a strong push in the way the healthcare system is in the UK is different from the US. It's largely like tax government funded as opposed to the US where it's insurance, private stuff. So here they try to get the most efficient, like a clinician that can manage so many things, not just one area, because most patients now don't just come with diabetes. They'll have diabetes, they'll have hypertension, heart failure. So they want someone that can integrate everything, manage all those conditions rather than go to an endocrine specialist, which is hormone specialist for your diabetes, go to cardiology for your heart failure, they don't, we don't have the resources because to be doing all of that, we need an integrated system that is able to manage all these things at once. So that's why there's a real push for it um in the UK, even with people. It didn't used to be the case a few years ago because a few years ago, if you're doing your cardiology, just focus on your cardiology, but which is heart, the study of the heart. But now, even if you're doing your cardiology, you have to do it alongside internal medicine because you're going to meet patients with heart conditions that also have conditions in other systems. Next slide, please. So why internal medicine? So if you like managing complex patients that come in with problems, like I said, affecting different organs, they're not just coming in with diabetes and that's it. They're coming in, yes, they have diabetes, but they have also had a stroke. They have problems with their heart, hypertension. So you can manage all that. You like complex patients, internal medicines for you. You like a broad knowledge of medicine. You don't just want to know about, let's say, just the heart, just the lungs. You want to know about the system as a whole, how the whole body. You enjoy variety. So instead of just focusing on one heart, maybe just the heart, there's just a limited number of conditions that can come in affecting the heart. But you like variety, you never know what will come up in a shift. So you can see the heart, you see the lungs, you see people with kidney failure, things like that, sepsis. So you can manage a lot of things. You like working in the hospital environment as opposed to working in like your own clinic because these patients are quite unwell, they need management in the hospital. And it's not limited, like I said, in the UK system, you don't have to just be an internal medicine physician. You can do it the stage two, you can combine it with a different specialty. For instance, myself, I'm planning to do a dual specialization in what we call endocrinology, which is the study of hormones. So if you've heard about thyroid hormones, diabetes, things like that. I won't go into too much detail just for the complexity, but it's basically the study of hormones. So I'll still be seeing general patients, but I'll have at the end of my training have my own clinics where I'm seeing patients with hormonal problems. So next slide, please. So just wanted to explain the pathway again in more detail for the UK if you're intending to come to the UK. So again, you can do it on the left part of the slide. You can do just internal medicine and just standalone. So do the foundation training 2 years, which I explained earlier, everyone does. Then you do internal medicine training, just the first stage, which is what I'm finishing at the end of this month, actually. Then you do just internal medicine training, stage two, which is 3 years before becoming a consultant, but you have just one certificate of completion. So you be a consultant just in internal medicine. On the right of the slide is when you're doing internal medicine in combination with other specialties. So the first one, group one specialties, I won't go into too much details, but it's things like if you're studying the heart, like cardiology, um, the lungs, respiratory physician, you're studying the alimentary canal, you're a gastroenterologist, that's what it's called, or renal physician, which is study of the kidneys. That's group and endocrine as well, study of hormones is a group one specialty. So in addition, after the internal medicine stage one training, you now do for the stage two, you combine it with your specialty. So that makes it 4 years before you become a consultant in both specialties. So it's a dual specialization. Then group two specialties, which is the bottom right. Um, After you do your internal medicine training, stage one, you need to do it for only 2 years. These are things like skin doctors, dermatologists, cancer doctors, oncologists, people that study like sickle cell, blood related conditions, hematologists. They are group two specialties. So they do just a bit of internal medicine training for 2 years for their first stage before going on to their specialty training. So if they're doing like skin, they do just dermatology for the 4 years, and they at the end of the day they get just a single, so it's a single specialization because they didn't do the internal medicine stage two training. So they become consultants in just that area, like dermatology. Okay, next slide, please. Okay, so I was asked what is the future of internal medicine. Like I said, in the West, there's a big push for an integrated healthcare because now is the thing, people are living very long, but unfortunately, even if they're living long, doesn't mean they're living healthy. So there you see some patients are on like medications for like 10 different illnesses that you see. So being able to integrate it all is the priority now in healthcare, especially in the West. So there's a big push for internal medicine physicians that can really manage different organs, not just a single organ, and manage different illnesses as well, and make a plan. Because sometimes if you're treating a patient with that has like hypertension and they have kidney failure, the medications you give for the hypertension can affect the kidneys. So you need someone that knows these things, that knows how to manage different problems in different organs, and give a really cohesive plan rather than just let me focus on my hypertension. I don't care what happens to the kidneys. So you need someone that's able to do that. So there's a big push for internal medicine, and that's where the West is moving towards. because it's really efficient as well. Imagine a patient comes into hospital with different problems rather than saying, oh, they want to wait to see a heart doctor, they want to wait to see a kidney doctor, they want to wait to see. They can just see one consultant that can manage these problems. Then, if the initial management doesn't work, let's say with the heart, they can now refer rather than just having to see all those specialties from the onset. So it's something to really consider because it's going to be the real focus of the future. Next slide, please. Um, I was asked about AI in internal medicine. Um, so there's obviously a role in for AI in different jobs and careers. Like in medicine, I think, and is already in some areas anyway, things like interpretation of scans, like information searches. We have this chat GPT. In the future, I think there'll be things like using AI to predict risk, like seeing who is likely to get diabetes based on maybe their body BMI, what we call the body mass index, how big they are, their genetics. There'll be things like that. I'm seeing disease trends like before COVID-19 comes or like another pandemic, AI will be able to assess the disease patterns and predict what will happen. I think that is a strong potential for AI, and potentially like saying prognostication means saying how well you think patients are going to respond to treatment. How long do you think patients have to live with certain conditions? Because now we as physicians we give estimate based on our experience. But in the future, I think there'll be like mathematical models that may be more accurate rather than me just saying, oh, I think based on patients I've seen with this condition, I think this patient may have less than 6 months to live. But that is my subjective opinion. There might be models in the future that'll be able to say, oh, this is their blood test, this is the trend. Based on their age, their risk factors, this is how long they have approximately to live. That's what I think. However, I don't think it can ever replace the role of a physician because there's so many things we do in terms of assessing and decision making skills that AI cannot manage. For instance, medical decision making is very complex. No two patients are the same. Um, Predicting based on one patient on another patient, it will shock you how patients respond so differently. And even the way there are things that just visually when you see a patient, you can be able to um decide how you treat them based on, let's say, if you think they have excess fluid, just seeing them is not something the computer will be able to detect, seeing how maybe you need to drain out fluid, basing it on how you've examined them and things. I don't think AI will be able to do that, but there's a role, like I said, for AI to help in other things, but not to replace a physician. Then also AI, one thing is AI is which is artificial intelligence, by the way, is limited by the information given to it, which patients don't always describe their symptoms the way textbooks describe it. A patient can say, oh, I feel like a ball is in my head when they're trying to explain maybe a tension headache, which you're not going to be able to put that into a system except a clinician is able to say, oh, explain, does this um is it affecting both sides of the head, be able to get more information that AI may not be able to elicit. So you need a clinician to properly get the information before you even talk about feeding it into the AI. Because if you feed in the wrong information, you get the wrong results. There are a lot of my patients that come, oh, they've Googled, they had a headache, and the first thing that came up on Google was, oh, brain tumor, which they have nothing like that. The headache is just due to stress. But that's the point we're getting to, that it depends on the information you feed it. Then there's also a big, what we call medical legal, like, because we as doctors, if you do the wrong thing, you could, unfortunately, sometimes you could go to court. But if AI gives you wrong advice and something happens, who do we blame? And who is actually taking responsibility for this artificial intelligence errors? So I don't think AI can ever replace a physician. It can work alongside, it can be like a collaborative effort, but it won't replace physicians. I don't think so. That's my opinion anyway. Next slide, please. So to wrap up, I just thought I'll just give some general advice. A career in medicine is a very long road, like I said. It's taken me so many years to get here. It takes a lot of commitment, time, effort, money. But look at it this way. For me, it's a marathon, it's not a sprint. And people often ask, oh, it's so long. Like people, when I wanted to get into medical school, a friend from church was like, do you want to spend another 5 years studying medicine? I'm like, yeah, in the long run, I'm going to be working, 40 years of my life or 30 something years. There's no point just making decisions for the short term rather than thinking about the long term. So think in the long term what you enjoy doing. And I think it's not a bad career at all. It's really good. I enjoy it. Ensure you want to do it for the right reasons. I think thanks to JuCE for all the career education they're giving you guys is really important, because a lot of people don't have good career education. um Ensure you get like exposure to it if you want to be not just medicine, any career. Talk to people like what we're doing there in the career. If possible, do some shadowing, go and see how they work, their day-to-day life um in the workplace, because you want to make an informed choice for a career. You don't want to invest your time going to medical school. I've seen that happen to some people, and they start working and they're like, oh, this is very different from what I thought. And they drop out when they have already invested so much. So our advice, try to get work experience, clinical exposure, see how practicing doctors live their lives day to day, so you can see the reality of the situation, not just what you think it is. Don't just do it because maybe your mom or people. I know in Nigeria, like medicine, engineering, law, accounting. No, find out that you really want to do it for the right reasons. You want to help people and all that. It's a very fulfilling career, honestly. I enjoy it, gives me a lot of satisfaction when I see that I've put in my skills and people have gotten better as a result of my management plans. So if it ticks your boxes, please go for it. Like, don't be discouraged. You can do it. Again, another lady asked me regarding like her daughter was thinking of medicine, and she was like, do you need to be a genius to study medicine? No, you don't need to be. But you have to be willing to work really hard and be organized. Um, Try as much as possible to have a balanced life. It's a long career. Don't neglect your loved ones, your hobbies. Obviously, you need good time management. But the reality of the situation is there's a lot of emotional involvement in medicine. So you have to have a life outside your career to prevent burnout. Um, just general career advice, weigh up your skills. If you want to be a surgeon, do you have the manual dexterity? Like personally, for me, I'm like anything too that involves small cuts. If it's big cuts, fair enough, I can do it. But anything too technical with fingers, I know that I'm not good at it, so I can be very clumsy. So I knew that any very detailed surgery, like neurosurgery, will not be for me. So it's just about telling yourself the truth, seeing your skills, weighing up your skills, weighing up what you enjoy as well. You're going to be in this career for like 30, 40 years. Make sure it's something you enjoy. Look at the career prospects. I know I spoke earlier about it. Like, a lot of people, it's different in Nigeria, but here people do they take student loans to go to uni, and at the end of the day, you can't find a job because you've done a degree that is not really a marketable degree, and the universities won't tell you. They just want you to come and put your money and do this course. So you do your own investigation that yes, I enjoy doing this thing. Maybe if it's music, yes, I enjoy music, but what are the prospects at the end of it? And is it something I necessarily have to go to uni or spend so much money doing? Whereas because some careers, people that do like apprenticeships or people that have the skills, like for instance, I don't know if you do maybe painting, study it in painting, someone that has the natural ability to paint maybe do far better than you because that is a career that is not about the theoretical work, is something practical. So those are things to consider. Um, yeah, thank you very much. No, this was very short, but if you have any questions, please ask. Thank you.
All right, thank you so much.
Mhm.
Very, very like most of it was actually going on my head was very
Sorry, I can't hear you
Daniel,
properly,
your
Daniel.
voice is low.
okay. Hi, I don't know why that is. I was just saying that I was very ready. Like because I was always mentioned I'm a lawyer and most of it go over my head. Thankfully, you were very you're acting like made it very simple. And maybe I can go and get my internal medical degree after this also. Well, thank you so much. So we'll
Thank
cut
you.
to the chase with questions and answers. So to any first.
Da-
If I
Daniel?
someone speaking, yeah.
Yeah, no, sorry. It's just your voice is really low and it's hard to hear you. So I was hoping I could um I was hoping I could work with the question and answer because it's
Okay,
super
sure,
tough
sure,
to
sure.
hear you.
Yeah, I
Sorry.
think I'm having a network down. So yeah,
Oh,
I don't
okay. But please keep sharing your screen because that will be useful. But okay, thank you, Dr. Songa. Thank you
Thank you.
for the very detailed. I know you were saying, I know you were saying, oh, this is just for yeah, I think it's even a lot for our kids, but I love that it's that detailed, for as much information as possible. And like I shared at the beginning, there are people who watch this recording when we're done, and it's nice for them to get this type of information. I like when you spoke about the differences between the UK system and the US system. Again, for a child who is potentially thinking of going into university, because with our university preparation programs, this is something we also try to do, exploring options not just in Nigeria, but in the US, in the UK, everywhere. So they have an idea. So thank you for that kind of detail. So what we're going to do is to see if any of the kids from Center for Memories in Enugu have a question. Um, Yes, so that's the first thing we're going to do. Please, the teachers in Center for Memory, or the volunteers there, please can you find out if the children have a question that is relevant for this topic today? I know that sometimes the questions are more general, to many other career questions. Don't worry, we will get to that in the future. But if they have a question that is relevant for today, please maybe take the questions, get them ready. But in the meantime, what we want to do is to open up the questions to the people in the audience, well, not in the audience, to the other people online, right? If anyone has a question, please raise your hand and we will get to you. I personally have a question, but so I'm going to ask first, and then in the meantime, if any other person raises their hand, we will take questions. Okay. So, my question, Songa, is you've spoken a lot, and it's obvious about the financial implication of studying medicine. What kind of advice would you give to somebody who is interested in it, and they might not have that financial wherewithal? What type of advice? Then secondly, last 2 weeks we had a question from a young person in, I believe he was in SS1, who spoke about wanting to study veterinary medicine, but his parents want him to study like human medicine. I don't know if that makes sense.
Yeah.
But I wanted to bring that question back again, so that you could maybe comment on it since we have a medical practitioner here today. So those are the first two questions. But if anyone else has a question, please raise your hand and then we will come back to you, Center for Memories. Thank you.
Okay, thank you so much, Ada. So the first question, the financial bit of medicine. It varies depending on your country. Like Nigeria is relatively cheaper, a lot relatively cheaper actually, compared to like going to the UK and US. And actually, after your first year, because I told you I was in UNILAG for 1 year, and at the end of it, actually, there was a scholarship offer I got. So there's scholarships available if you do really well academically in the Nigerian setting, actually. I know, is it Miss Folorunsho Lakija has one of them. There's some oil companies. I think I got the Shell one, but I didn't use it because I moved to the UK. So Nigeria, if you do really well academically, there's scholarship opportunities um available. So that shouldn't put you off. UK, I'll be honest, as an international student, I'll just advise you probably if you're not financially buoyant, don't come because the thing is, so I told you I was on a scholarship that ended, like that was another story on its own. Nigerian government things not reliable. So my parents had to step in to sponsor me for medical school actually. And with the variable exchange rates, the money that we budgeted from the beginning, it changed. Like by 2016, another government came into power and the naira to pound rate, because my parents are in Nigeria earning there, it became so uncomfortable. Thank God for provision, but that's the reality of the situation. Whatever you're budgeting to go abroad, just our advice, add at least 50% if you're earning in, or whoever is sponsoring you is earning in naira, because it's so volatile with the rates. US system, there's also scholarship opportunities. UK, not really for international students. You may get like small grants here and there, but like few £100, it won't touch anything. US, there's things like if you're like good in sports, there's some sports scholarships, but that is not 100%. I would say to go abroad to study medicine, to be honest, I'll say have a good financial standing. There's cheaper countries people go to. I know people go to Poland, people go to the Caribbean. So don't be limited by UK, US, or Australia. There's other options as well. And after doing your degree in these countries, if you don't want to study in Nigeria, you can always write entrance exams to work in the UK or US. Like UK is PLAB. So there's quite a few people that have studied in Bulgaria that is a lot cheaper than like the UK and have come after a while, although it may be more of a lengthy process, but it's totally possible. People do it. That's the first one. So the second question was about veterinary medicine. I remember teasing my dad one time in secondary school that what if I do veterinary medicine? Because I saw one vet clinic. He was like, hey, in Nigeria, like who would you want to starve? But I think it's a good career, but it depends on your location. I'll be honest, in Nigeria, it may not be as lucrative. A lot of people that do like vet medicine, they have things on the side, or they are involved in, rather than just treating the animals, they're involved in like sale of dogs and all that, because we don't have, first of all, we're not a very pet friendly society. We don't have a lot of pets. And even when people that have pets, only the rich people really give proper veterinary care. So keep that in mind if you're looking for a good career prospect and you don't want to leave Nigeria. I'll say it may not be that financially lucrative. And it will depend on the location. I imagine like Lagos, Abuja is better than, let's say, if you're in a really remote location. But human medicine is a safer choice in terms of prospects in the setting of Nigeria. I'm not saying it's impossible to make it as a vet doctor, but it's going to be a much of a higher, like steep climb to financial success, to be honest.
Okay, thank you so much, Songo. Thank you for that very honest response, especially on the second one. You know, one thing we often say at JuCE is that our parents are not wicked, and most parents are not wicked, and they are not crazy. What they are really looking out for, especially in Nigeria, the way Nigeria is how can I make sure that you come out of school, you have a job, and you're able to financially sustain yourself? We don't
Mm,
have a a social security system in Nigeria. So
mm.
your only hope is what you can do, what money you can make for yourself. You know, so thank you for that honest perspective. And thank you as well for the first question on the scholarships, because we had someone who said, um, he first of all thanked you for the very educative section, um, or session rather. And he said, "Can I get full scholarship to study medicine in the US? And what are the requirements?" I think you've dealt with that to some extent. But one thing I can say, Michael, is first of all, in terms of requirements, that's an assignment you do for yourself. We said this, I don't know if you were at our how to prepare, the very first university preparation session we had. We spoke about the importance of research. Just sitting down, going online, using your Google, your computer for the right reasons, and just searching school by school, you know, what do they want? What do they need? How can I get in? You curate it, and then you now say, based on these things they want, what do I have? What am I able to meet? What can I not meet? And you work at it, right? There are scholarships available, but as you heard from Ms. Songo, especially with medicine, it might not be complete, it might not be full, and it's a very expensive and long career. She also gave you the opportunity, like she said, or she gave the insight of going to a cheaper country and then transferring to the US, transferring to the UK when you're done. That's what many people do, you know, like she said. So that's also something to explore. If you want support in terms of exploring this scholarship path, exploring this your journey, JuCE is here to support you. So send us an email as on this info@juiceafrica.org, and we will, you know, connect with you and keep supporting you. So that's that question. In okay, so thank you, Songo, for those two.
Thank you.
Center for Memories, are there any questions pertinent to today's conversation on studying medicine / internal medicine? Please, if there are, please, could you let's unmute, let the kids ask, and Dr. Songo will respond. I think there are kids coming forward, so that must mean there are questions. So I'm going to give them the opportunity to speak. Thank you.
Good morning. My question is the meaning of internal medicine.
Okay.
Okay, so it's the kind is a kind of adult medicine where we deal with prevention of diseases, we deal with diagnosing, that's we assess the patient, decide what illness they have, then we treat based on our diagnosis. And it's not just one system that we treat different organs of the body, like all the internal organs, like your brain, your heart, your lungs, your kidneys, your thyroid gland, like your hormones and all that, your alimentary canal, that's what internal medicine is. So it's just an integrated kind of medicine that is not focused on one organ.
Thank you.
Yeah. Is that enough? Does that answer your question?
Yes.
Okay, thank you.
What is the main purpose for using AI in internal medicine?
Sorry?
What is the main purpose of using AI in internal medicine?
I think the thing is AI, like I said, is supposed to collaborate to help not just internal medicine, different sectors. So now they want to try to make medicine more efficient. Is there a way AI can help diagnose, help recommend treatment based on the information that you put into the in, artificial intelligence system, help predict like disease patterns, like if for instance we have COVID, they're working on tools to be able to say where the next pandemic or epidemic could be, um, things like that.
Okay.
Okay, thank you.
Okay. I think based on the people who came forward, is there any other question?
Someone
Yeah.
is coming forward.
If you want to study nurse or doctor, will you still study medicine and which type of course?
No, so if you want to study nursing and is it dentistry, you said?
Doctor.
No.
So
No, sorry,
If
I
you
don't.
want if you want to study nurse or doctor, will you still study medicine and which type of course?
Okay, so nursing, you don't study medicine. That's a different career pathway. But to be a doctor, you must study, like to be a medical doctor, you must study medicine.
Okay. Thank
Okay,
you.
thank you.
okay. Thank you so much, Center for Memories. Thank you for always showing up. And thank you for your questions, kids. I think it shows that you're listening. But one thing I would advise as well is I think you people are quite young in terms of the class. So as you get to JSS2, for example, the person who asked about studying nursing or being a doctor, as you get to SS1, SS2, when you have to start thinking about, okay, I'm entering the university now, come back and watch this video, okay, and see how you can position yourself, how you can help yourself to be in the best position. Dr. Songo gave so much insight, honestly. She gave so much information. So please come back, please listen to this, and please, yeah, and use it. Like I always say, if, for example, you have a question later for Dr. Songo or for just in the medical practitioner world, or you can send us a message at info@JuCE Africa. It's on the screen. We will then get it to Dr. Songo. When she has some time, she will answer, she will get back to you. Okay. So yeah, so thank you everybody for listening today. Daniel, if you could just go to the next to power presentations.
Slides.
Yes. um yeah, so thank you for that. And then in terms of upcoming events, we have parental influence in choosing careers. We've had plenty of questions here where kids say, I want to study this, but my parents want me to study this. Oh, I'm thinking of this, but my parents said, lie, we can never do that. Okay. So if you have that, we have three young professionals. We have someone in the tech industry, we have someone in the design industry, and we have a communication specialist. You've heard from Somto before, our resident animator. He talked about how he wanted to study graphic design, and his parents said, where? And then he had to go and study microbiology and come out, and now he's a graphic designer and one of the top animators in Nigeria. So he's going to talk to you. If your parents are already telling you this is what you have to study, and you know you don't even like it, or you don't even think you're good at it, this would be a very interesting conversation for you. And if possible, invite your parents. Okay, let them be here so that when we are sharing, when we are talking, it makes it easier for you to have that conversation with them later. Okay. So that's it for today. The last slide, please, so that they see our social media handles. Um, yeah, but that's it for today. Someone has asked already if how they can find the recording. It's on our YouTube, JuCE Africa. I've also put it in the chat. So please, every single thing we do, we record and we share on our YouTube page. So please feel free to go watch it, share it with other young people. Thank you so much, Daniel, for excellent hosting today. I know your mic refused at the end for you to continue, but thank you for stepping up and stepping in. Daniel is one of our trustees at JuCE. So thank you for stepping in. And then thank you, Dr. Songo, for, I have to say, I chased Dr. Songo. I chased her because no, but that's the thing, kids, if you're thinking of studying medicine, it's not easy. It's fun, like she said, it's fulfilling, but she was so busy. And every time I'll say, oh, in fact, I started chasing her from last year, and she said I cannot commit for July as at December. Do you understand? Because she has to, her plan, her time is not completely her own in that way. So she had to say, okay, let's talk about it closer to the time, closer to the time. And finally, she's here today. And as you can see, there's a reason why I needed her to be here. So thank you so much for availing us of your time.
Thank you
And
for
thank you
having
for,
me.
yeah.
And thank you for the work you're doing. It's so brilliant. I hope more people can benefit from this, honestly. Hopefully, with time, more people will join.
Absolutely,
Yeah.
absolutely. So thank you so much. And yes, for everyone who is on the call, thank you for spending your Saturday with us. We know it's kind of like, Saturday, it's weekend, it's time to rest, but thank you for showing up. And kids, I hope you really enjoy this and you benefited from this and you're supported by this. Okay, we're going to round up for today. I think in record time, because usually we never finish on time, but we finished in record time today, so that's wonderful. So thanks everybody. Have a great Saturday, and I'll stop recording now. Take care. Bye bye.